In this video, we will be discussing cultural factors and characteristics that affect patient and client management. For this video, we've come up with 4 different categories that we feel are important to focus on. These are religion, social norms, language and body language, and socioeconomic background.
As clinicians, it's really important that we understand culture, not only from a competence level, but also from a humility level. Oftentimes these groups are marginalized and experience a lot of disparities. When we think of it from a socioeconomic standpoint, this is going to be those social determinants of health. So income status, education status, environmental factors, social factors. As far as income status goes, a lot of times individuals may avoid or can't afford healthcare. Educationally, this is more so dealing with health literacy aspects or the understanding of healthcare. And then when we think of environmental and social aspects, this could be barriers that present due to transportation, or they may live in unsafe living environments, or just seeking healthcare in general may not be encouraged. It's been noted that those with lower socioeconomic statuses have reduced access to care and results in poorer healthcare outcomes. It's been noted that 39% of African American children and adolescents and 33% of Latino children and adolescents currently live in poverty. And these individuals are likely to experience poor health due to combinations of a lot of issues, dealing with environment, dealing with income, dealing with social aspects. So it's really important that we take a mindful approach into managing these individuals.
In this section, I'll be talking about language and body language in care. So it's important that those who do not speak the same language as us are still getting the same level of care. So it's important to use a trained translator when at all possible. Try not to use family and friends because this can skew the clear communication and it can also impact privacy. It's also important to talk directly to the patient even when using a translator. And then even with a language barrier, body language makes up a lot of communication. It's important to realize that there are different body language norms in American and Western cultures. So it's important to be aware of where these differences might show up for someone who has a different cultural background than yourself. Overall, be aware of how this varies between cultures. Ask the patient how you can best accommodate them if you're unsure. Be respectful and prioritize continuing education on culturally competent care.
Religion plays a large role in healthcare and overall healthcare decisions. So things like patients' beliefs and practices are going to play a role. So health decisions, for example, could be Jehovah's Witness, where they are unable to accept blood transfusions, which can obviously be a life-altering decision there. And then things like end-of-life care, as well as modesty and gender roles. So some religions will require a same-sex doctor for certain practices, as well as us as providers just being able to be educated on different religions and the rules and regulations that that people prefer with this, and then also being aware of dietary restrictions. So some religions may do fasting or not be able to use tobacco or certain medications, things like that. So us as practitioners just being aware of all of that.
Social norms vary across different cultures, communities, age groups, and even gender identities. They affect everything from communication style to treatment expectations. For example, eye contact. In some cultures, for example, Western cultures, eye contact is seen as showing confidence and engagement, while in other cultures such as Asian or indigenous communities, it may be disrespectful or confrontational. Another example is the perception of pain and disability. In some cultures, it is the norm to encourage discouraging patients from seeking out help and instead just dealing with it at home or possibly just doing home remedies instead. Another example is touch and personal space. Manual therapy, palpation, and physical contact are routine in physical therapy. Some cultures, for example Muslim cultures, may choose to not partake in certain treatments, or if they do, they would like to have a gender that suits their needs, for example same genders usually. Physical therapists, we can be competent in these care principles and just be aware and acknowledge these social norms and try to accommodate to them.